There's one more thing that guys tend to do that sets them up. It's sort of a precursor or a prelude to an inefficient arm action. We call it a pronated takeaway. Lots of guys have been taught to break the ball over their leg, take their arm back so that when we look at you from the side, we would see the back of your hand, and then point the ball towards second base. Now, when we do this, we'll talk about this a little bit more as we talk about the first responders on the D-cell side, but as you do this, you preset these forearm muscles in a hyperpronated position. Now, when you activate these muscles, they serve to impart a varus stress, the opposite of what the UCL has to resist. They impart a varus stress on the elbow, and they're responsible for about 14% of the attenuation on the torque on the elbow. Now, they're the first guys in the kinetic chain because they're anatomically right there at the scene of the crime, so we call them the first responders, and their job is to protect the UCL until the rest of the members of the kinetic chain, the shoulder, the torso, the hips, the glutes, the ankles, all the way down to your feet, come in to try to take some of that stress off your Tommy John ligaments. So this pronated takeaway, where we take the ball out and point it and have the ball facing behind you and then pointing towards second base, is going to set you up for a medial elbow pain, because what it does is when you go to get behind the ball, you have to actually turn off those first responder muscles at the most critical time in the delivery, and they're not there to help impart that varus stress on the elbow to take away some of the torque on the Tommy John ligament. So we call that a pronated takeaway, and it is also a possible contributor to medial elbow pain.